You can see the red color dot. I cannot see. Maybe you can see. These two red color dot is very important for the stroke because of due to this part, the blood cannot flow over here. This part is called blockage, and here burst. After burst, that's why the stroke come off. You can feel. Let's say the patient cannot move. You try to move here. Here, it's like wow, very painful. Even I press here, painful. If a no problem one, you press, you see, very nice one, very nice, very nice. You go to the patient, the neck you just press hard like this. It's just like stretching. You pull down. Then you know you're marking on the stroke patient point. Poke over here. So this is a marking. Then after that, press this one. Not so pain. Oh, very flexible. Good. And try to move on the center. Here. Then here got the one bounding. This side got one bounding. Whatever bounding, this is called blockage, or we call it a C1 to C7 between C3, C4 compress the nerve over here. So you know this part, the patient you press here, wow, very painful. Pain. The patient cannot talk lah. Press here? No. So what you do? I want you to get a roller and roll or the guasa board, means the board and guasa over here, and put some ointment guasa until the red color. Until here red, you can see one big knob. Red color become black. But until here black knob, until black knob over here. You try to use a spoon also can. Spoon, you know the spoon, you put some ointment over and try to guasa. We call it wrapping. Guasa. So until the red scar and red dot come out. You can see one is bounding. Whatever the bounding, that one is called cord blood. You do a few more time. After that, you try to press back to the patient. Press. You put E. Then the patient no more shock, no more pain. He smile like this. Then should be okay. Then after that, you do on this side also. After done ready, I want you to do on the patient neck. Don't manipulation after that. Like this. I want you to, the patient cannot move. Just imagine here is the bed. Then you do guasa here, and try to push the neck on the one side and try to support on one side. Like this. For how long? Pressing for the stroke patient more than 1 year's one. Don't too hard. Until you can feel the tense over here. For how long? You do it about 1 or 2 minutes, means about 60 seconds or 100 seconds, like this, and try to push over this side. Okay, push on the one and left, right. This one to open up the tunnel on the neck to let the blood circulation over here, especially the stroke nerve on the neck, SCM muscle behind. Alright, so this one is done ready. Then after that, you press back again. You can feel very soft. Very soft, and the center part also very soft. Then after that, I want you to check on the patient, means the stroke patient more than 1 year ready. Then you check that this hand up. So high, no problem. This hand no problem because of here affect this hand. So usually hand like this. After you do massage on this part, this is after you massage on the neck, this part, and then this one 60 seconds, do 2 times like this, and then guasa. Then after that you check that. No need to do anything, no need to do any physio first. You check back on it. Then you check back on this hand. And the person, the hand feel more lighter and feel more flexible, and can not like this can at least can more lighter and more flexible and more higher. And the check back the leg, you try to lift up this leg until you just now this leg cannot lift up. Then after you lift up, no shocking and no pain, less pain, because why? You open up the signal to your whole body. Because why? A lot of people of the stroke is due to the brain damage on one side, affect the another side, no more signal. So what we do is called like a signal connection. We call it signal connection. So because of the firewall, like antivirus, the fire blocking and cannot get the signal. So you take up the wall only. So the signal slowly combine. Whatever combine, then you ask the patient do the exercise. So what exercise you do? What exercise you do? You're at the home to teach back to the patients the stroke patient more than 1 year. Just now that one is a pre-stroke. So this one is a stroke already. What should you do? You have to do a lot of especially stroke patient due to this side affect this side. So this side no problem, up here no problem, and this side up like this pain and then up like this. The first thing you have to open up the finger, because why the finger always like this? If you ever stroke more than 2 years or 3 years, then it become like this. We call it the nerve and the muscle and the tendon all strange already. If you do like this, I cannot do anything because of what? All condemned already. So what you do, have to loosen up all the finger or shake hand like this and pull. I have to do this physio to loosen up the muscle. The second one is the up the raise and relax back the raise for the patient. And the third one, slowly and slowly. And the last one for the shoulder, this is a bit painful. You have to check whether they got the shoulder drop or dislocation before or not. So slowly up until which part? Until here. No pain, then slightly higher. Until pain, then you slowly rotate left and rotate right to loosen up all the joint part and the muscle. Okay, if you like this, after that, you have to do a lot of exercise for the patients, for stroke patient. Then for the legs, then you have to lift up. Lift up, sleep, and lift up, and ask the person strength down. Up and strength down. Or drop first, then you how strong the leg. Then ask the person to kick out, kick out. If it's possible, to ask the stroke patient, especially at home, he can move a little bit. Let's say he can recover, and he want to speed up the exercise at home. You do physio. You can put because the lift up the hand very difficult. You can put a string to the door and put the weight of this side. So he hanging carry up the string to the door, whatever. He will lift up. He will lift up your hand like this. Then ask the patient to try to pull down. Slowly pull down. Then after pull down, you automatic up first. Pull up, the up. Pull down, up to exercise that and build up back the muscle of the patient. Alright. And also the leg, you can ask the patient try to lift up like this and slowly kick. And this leg, this hand, no strength, this leg no strength, this leg pull up like this and slowly ask him to kick up and impact and slowly kick and impact and slowly kick. Or the best way to invest to what I call the bicycle. At home, the indoor bicycle. So you know the indoor bicycle, there are indoor bicycle, the sitting, cannot move one, not the go to the market one. At home one, the RPM we call it. Then you do a lot of cycling for the stroke patient more than 1 year. So because why? You are using the good leg to strengthen that and move cycling to let the knee joint and the hip joint to exercise back the cartilage and muscle, to strengthen back the muscle for the stroke patient more than 1 year. Alright, so this is the exercise. After that, then you have to check that again over here. Wow, no pain already. Whatever the back head of the signal to the whole body feel better and no pain, then the signal to the hand and the leg should be better. And this is a few of the technique. And do kwasa and do neck stretching from the push all the way to one side. Let the blood circulation flow back on the left and right for how long? 60 seconds. And last side 60 seconds. Then you test back all the movement and try to do it every day until the patient feel good and got the strength. Then after, ask him to use back the what I call the foreleg, the stand to slowly walk to build up back the strength. Good.